Welcome to today's explainer. So today we're going to build a mental map of what is basically a highly pressurized, completely dynamic biological reactor living right inside of you. We'll be zooming all the way from the macro boundaries of your anatomy straight down to the micromechanics. Our goal? To figure out exactly how your most vital digestive organs are packaged, protected, and organized to literally sustain your life. Okay, let's just dive right into this with a really quick question about your own body. When you feel a stomach ache, do you actually know exactly where your stomach lives inside of you? I mean, precision matters immensely here, right? Because an accurate map of your insides is often the critical difference between diagnosing a simple case of indigestion and catching a life-threatening organ rupture. So today, we're going to map out where your digestive organs truly live and how they operate in this incredibly densely packed shared space. Here is our roadmap for this explainer. First, we'll look at the grand ventral cavity. Then we'll step inside the abdominopelvic space, check out the abdominal digestive powerhouse, unpack the protective peritoneum, and finally, we'll wrap up with clinical mapping in quadrants. Let's start wide with section 1, the grand ventral cavity. To really grasp the mechanics of our digestive system, we first have to define the ventral cavity. Anatomists call the entire front half of your body the anterior, or ventral side. Now, this massive, fluid-filled compartment evolved specifically to allow for what we call visceral motility. It's absolutely vital because it acts like the main room of your bodily house, giving your delicate internal organs the necessary spatial freedom to literally shift around, expand, and contract during digestion and breathing, all without distorting your surrounding skeletal muscles. So, the body divides that massive front space into two distinct regions. Think of it like a two-story house. We've got an upper floor, which is the thoracic cavity containing your heart and lungs, safely locked inside a cage of bone. Then we have the sprawling abdominopelvic cavity acting as the lower floor. What separates them is a dome-shaped respiratory muscle called the diaphragm. But here's the thing, the diaphragm isn't just a static floor, it's a dynamic piston. Every single time you take a breath, it actively drops down. That dramatically changes the pressure in the abdominopelvic cavity below it to draw air into the lungs up top. Moving on to section 2, let's step down into that lower floor and explore inside the abdominopelvic space. What's truly fascinating here is that this massive lower space is completely open concept. Unlike your chest, which is totally sealed off by that sturdy diaphragm, there is absolutely no physical membrane dividing the top of the abdominopelvic cavity from the bottom. It's just one continuous, uninterrupted chamber. And clinically, this is incredibly significant because there's no physical wall there. A fluid leak or a severe infection in your upper abdomen can easily, and I mean rapidly, travel straight down into your pelvis. Now, even though there's no physical walls separating them, anatomists draw an imaginary line to divide this open concept area into two functional zones, the abdominal cavity on top and the pelvic cavity bounded by the hips down below. But in this shared space, the abdominal region, essentially the body's kitchen, completely dominates. Those digestive organs are massive and they require constant, dramatic expansion. Because of this, the abdominal organs effectively dictate the spatial dynamics of the entire cavity, just constantly exerting physical pressure downward onto the reproductive organs and bladder living in the pelvic utility room below. Let's shift our focus to section 3, the abdominal digestive powerhouse. This abdominal space is densely packed with the absolute heavyweight champions of your body. You really have to think of it as a highly integrated system. You've got the liver and pancreas acting as these massive chemical factories. The stomach is functioning as a heavy-duty mechanical churner. And the intestines? They serve as an incredibly sprawling nutrient absorption network. Along with the spleen, all of these complex, superactive organs are crammed tightly into a space roughly the size of a basketball, just constantly expanding, contracting, and processing biological material. But while we're mapping out this crowded room, we really have to note a vital anatomical exception. Your blood filter and kidneys sit in a position called retroperitoneal. This literally means they are tucked behind the protective membrane that wraps the rest of the abdominal cavity, secured right up against your back wall. This carries a major clinical takeaway for you. Because the kidneys sit outside that main abdominal wrap and rest so close to your back muscles, severe kidney issues, like stones or infections, almost always present as intense lower back pain, rather than pain in the front of your belly. Which brings us to section 4, the protective peritoneum. So you might be wondering, how do you pack so many active, constantly shifting organs into one cavity without total chaos? Well, the answer is the peritoneum. Imagine a balloon that you push your fist into. One layer wraps tightly around your fist. That's the visceral layer wrapping your organs. The outer layer of the balloon lines the cavity wall. That's the parietal layer. But keep in mind, it's not just a passive bag. The peritoneum is a highly vascularized, living membrane that actively fights abdominal infection and structurally suspends your organs, ensuring your yards and yards of intestines don't just tangle up inside of you. Right between those two layers of the peritoneum is a microscopic space filled with a slippery, serous fluid. And this is biologically essential. You see, digestion is a mechanically violent process. Your stomach is dramatically expanding, and your intestines undergo peristalsis, which are these relentless, wave-like muscle contractions used to move food along. Without this lubricating serous fluid, all this constant mechanical churning would cause your organs to literally rub themselves raw and trigger massive internal inflammation within just a matter of hours. However, this elegant system is definitely vulnerable. When the liver is failing, which is often from severe cirrhosis, patients develop a clinical condition called ascites. This is where massive amounts of fluid pool improperly right in that peritoneal space. Because of the open concept nature of the abdominopelvic cavity we talked about earlier, this accumulating fluid impacts the entire lower half of the torso. As the volume increases, it literally has nowhere to go but up, pushing aggressively against that diaphragm piston, restricting the lungs and leaving patients gasping for breath or experiencing what doctors call dyspnea. Finally, let's look at Section 5, Clinical Mapping and Quadrants. Because the abdominal cavity contains so many vital organs with no internal dividing walls, medical professionals rely on a sort of universal GPS coordinate system. They divide the abdomen into 4 distinct quadrants by drawing a vertical and horizontal line that intersects perfectly at ground zero, your umbilicus or belly button. This creates the right upper, right lower, and left lower quadrants, neatly mapping out this dense, chaotic space into clear, universally understood territories. In emergency medicine, they have a saying, time is tissue. This precise cartography literally saves lives. If a patient comes into the ER complaining of severe localized pain in the right lower quadrant, a doctor immediately knows the appendix lives right there. Because they can instantly correlate that specific quadrant with the organ, it bypasses hours of speculative testing and allows surgeons to move straight toward life-saving intervention before a rupture can even occur. While those quadrants are excellent for fast triage, sometimes even greater precision is required. Anatomists and surgeons will actually break this map down further into a highly detailed 9-region grid. It's kind of like moving from a broad state map down to a very precise zip code. And this matters intensely in the operating room. Surgeons use this 9-region system to plan precise macroscopic incisions, ensuring they enter the cavity correctly and avoid accidentally cutting through the wrong fascial layers or severing vital blood vessels. So let's test it out. Can you point to your own right lower quadrant right now? You now possess a mental map of the complex, frictionless powerhouse functioning inside you at this very moment. You know exactly how these digestive organs completely dominate their shared space, shape your overall anatomy, and signal for help when things go wrong. But consider this. We've mapped the organs, sure. But what happens when the millions of autonomous neurons lining this very cavity, a network often called your body's second brain, start sending intelligent signals all on their own? Well, that incredibly complex neural map is an explainer for another day. Thanks for joining us.